Hello, my name is Jordan Miller, and I'm pursuing a career in emergency medicine. Before medical school, I worked as an EMT, and those experiences shaped both my identity and the type of physician that I want to become. In the field, I learned quickly that emergency care is not just about rapid interventions, it's about understanding the whole person in front of you, who is often in one of the most vulnerable moments of their life. So when people ask, what is an osteopathic physician? I explain that a DO is a fully licensed physician who practices a full scope of modern medicine with a philosophy rooted in treating the patient as a dynamic, interconnected whole. Osteopathic medicine is built on four core tenets that the body is a unified whole, body, mind, and spirit, and that the body possesses self-regulatory and self-healing mechanisms, that structure and function are interrelated, and that rational treatment is based on these principles. Those principles were present, far before my medical education during my EMT years, before I had even heard of these ideas or these principles. For example, I remember when I was responding to a call for an older patient with shortness of breath, the initial concern, was cardiopulmonary, right? But taking a moment to listen to them, genuinely listen, I learned that she'd run out of her medications due to transportation issues and had been sleeping upright in a chair for weeks. That encounter wasn't just about treating the dyspnea, it was about understanding how her physical condition, her environment, her anxiety, and her social situation were all intertwined. Looking back, that was osteopathic medicine, really. Appreciating how the whole person and recognizing how structure, function, and circumstance came together to create illness, right? Another example came from a patient with chronic back pain. While my EMT scope was limited, simply helping to adjust their position and understanding how those body mechanics worsened his symptoms and validating how, this emotional stress showed me the importance of the relationship between structure and function and the importance of patient-centered communication. Those moments taught me that even in emergencies, small changes in how we listen and interact can meaningfully impact patient outcomes. As I move toward a career in emergency medicine, these experiences make osteopathic principles not just theoretical, but deeply practical. In the ED, patients come without appointments, without preparation, and often without any support. Using the tenets of osteopathic medicine helped me approach each patient with a mindset that sees beyond isolated symptoms, encourages diagnostic reasoning that considers biomechanics, physiology, and the broader psychosocial context. It also reminds me that even in a fast-paced environment, empathy and curiosity are clinical tools, not luxuries. So to me, being an osteopathic emergency physician means applying evidence-based medicine while honoring the human complexity beneath each complaint. It means acknowledging that patient's story is not just their vitals. It's about who they are as a whole person. Thank you.